and welcome back. I'm Mabel Jong. You're watching WHCC TV, coming to you live from Washington, D.C. Tufts Health Plan is a Massachusetts-based health plan company which is based in Watertown, Massachusetts, and Jean Yang is the president. Thank you so much for being here.
Nice to be here.
So, Dr. Yang, what are some of the things you're going to be covering in your panel today?
I'm actually not a doctor, but I do have the privilege of working with a lot of physicians.
Okay.
We are here today to participate in a panel that talks about Medicaid ACO, so that's the Accountable Care Organization model that is targeting the vulnerable population, which is really a very, very important topic that we're working on. And I will be joined by a panel of experts that represents expertise in data and integration and technology and patient engagement. So I'm looking forward to that discussion.
And how do you think health plans are going to need to adjust to the changes that we keep seeing towards value care?
It's a lot of adjustments, but it's also a lot of opportunities as well. So I would say health plans, for the most part, are very excited, if not increasingly excited, about the prospect of providers taking on more accountability and managing total cost of care. We do believe that providers are well situated to engage patients and intervene on their care in very effective ways, much more so than what health plans can do. Okay. So we're excited about the opportunity to collaborate. In Massachusetts, that is exactly what we're doing, which is we created strong partnerships between payers and providers where we have the benefit of concentrated volume and new opportunities to invest in infrastructure. So we're learning a lot from each other.
And what opportunities specifically do you think will lead into partnerships, and can you be more specific about partnerships?
Absolutely. So as you know, that the payers historically have been financially incentivized to manage total cost of care. What we do is manage utilization. We provide care management where we directly interact with patients to give them coaching and advice and coordination support. Providers historically have not done so. Their focus has been on providing care and making sure the medication is supplied, the treatment is provided, and as soon as the member leaves the clinical setting, the responsibility ends. There is no particular focus on follow-up, whereas health plans would be looking at the patient holistically, making sure that they are healthy and well in a sustainable manner. But that is changing because now providers are really increasingly focused on some of the important things that traditionally have been important to payers. So we're having lots of dialogues about what are the comprehensive needs that patients have before, during, and after their interactions with the providers. So providers are developing infrastructure that is very much of an extension of their clinical functions, going to patients' homes, developing relationships with families, addressing needs that are more than medical, but also social, et cetera. So we think that this is really where the opportunities are coming together because we're interested in working on the same things. So we have a lot of conversations about who is best situated to do what. For example, we believe that for the vast majority of patients where the most important thing is to keep them engaged, providers are the best situated to do so because they can really integrate care and management with the care provision. So as you deliver care, you can also make sure the patient is well managed. Whereas for some of the unique patients, whether they have very, very complex challenges, where they are community bound, where they don't come to the clinical setting very often for whatever reasons, health plans will have the benefit of engaging these patients more effectively because we have access to broader data sets, we have broader relationships in the network, we can do more to engage regulators and other constituents to think about supporting these patients holistically in more sophisticated manners. So this is really a divide and conquer exercise, pursuing some of the opportunities that we have not really appreciated before.
And how confident are you that providers are buying into this? It's sort of going out of the box of what they are normally trained to do. So do you feel that they do want a true partnership with health plans?
Yeah, we're more comfortable than they are. Sometimes it feels this way. Providers do have a lot to learn, but we believe that from an economic perspective, from a governance perspective, providers are increasingly mature in terms of taking on some of these opportunities. Prior to my joining Tufts Health Plan, I was actually running one of our provider ACO organizations, so I truly had the benefit of crossing the aisle, going from one side to another. I believe that the industry as a whole has a lot of opportunities in terms of sort of promoting the mutual understanding between payer and providers. Knowledge of each other's expertise and perspectives is growing, but far from adequate. So we have a lot of opportunities to learn from each other and make changes based on what we could pursue that we didn't have the capability before.
I mean, it does sound like the right thing to do.
That's right.
But what else could benefit the provider in becoming more engaged in the social determinants of health is what seems to be what you're addressing as well in your plans.
Well, a lot. I would say social determinants of health is a new important topic that we all are very focused on. The industry as a whole is relatively young, much as much as we focus a lot on it, I think there's a lot to learn about what are the best strategies and then tactical programs that we could pursue to address social determinants of health. Programs that generate high return on investment is fairly limited. The good news is that there are lots of organizations and constituents in the market that are highly interested in addressing social determinants of health. We work very, very closely with our government, for example, in this area, where there's a lot of interest in real investment. So we're very encouraged.
Wonderful. Okay, and Jean, let me ask you, what brings you back to the World Healthcare Congress? Why this event?
Oh, well, I was invited, so I had the privilege of being invited. But really, there are very few sort of forums that are as extensive and timely as this one. Just about every question that you have, you could find at least one session that focuses on it. So this kind of opportunity is very rare. And certainly it's a great opportunity to network as well. So I'm very happy to be here.
Jean, thank you so much for your time. And thank you for watching. Stay tuned. We have many more interviews scheduled.